As a brain doctor, a neurologist who has spent years studying the brain and its delicate systems, I've seen countless cases of stroke, memory loss, and neurological decline in seniors. But today, I want to share something that truly shocked me. It's about a routine test, something many seniors undergo without a second thought. But under certain conditions, this standard medical procedure can raise the risk of stroke overnight. Let me explain. Point number one, the hidden risk in routine tests. Many seniors are sent for tests like overnight blood pressure monitoring, cardiac stress tests, or even CT scans with contrast dye, all in the name of caution. But here's the truth. If these are poorly managed, or if the patient's individual health isn't considered, they can trigger dangerous spikes in blood pressure, disrupt sleep, or cause dehydration. And for an aging brain, that can be catastrophic. I've seen it happen. A patient comes in for a simple test, and the next day they're confused, slurring words, signs of a mini stroke, or worse. Point two, the aging brain is more fragile. As we age, our blood vessels become more fragile. They stiffen. They're more prone to tiny leaks or clots. What might seem like a small fluctuation in blood pressure for a younger person could be enough to burst a vessel or block blood flow in a senior's brain. That's why routine should never mean automatic, especially for older adults. Point 2.3, tips for safer health management. So what can you do? Here are a few practical, potentially life-saving tips. Ask questions before every test. Is this necessary? Are there safer alternatives? Stay hydrated, especially before tests that involve fasting or contrast dyes. Get your medications reviewed regularly, particularly those that affect blood pressure or blood thinning. Protect your sleep. Poor sleep, especially in hospitals or labs, can trigger neurological stress in seniors. Incorporate gentle movement daily and practice relaxation techniques like deep breathing or meditation to keep your nervous system in balance. Point 4, be your own health advocate. I urge all seniors and caregivers, never be afraid to question medical routines. Medicine is evolving, but not fast enough when it comes to personalized care for seniors. What works for a 40-year-old may be risky for someone at 70 or 80. You deserve a care plan tailored to your body, your brain, your history. Get second opinions. Voice concerns. You are the most important member of your healthcare team. Let me tell you a story that illustrates just how dangerous a so-called routine test can be, especially for older adults. A patient of mine, a 74-year-old woman in reasonably good health, was scheduled for an overnight blood pressure monitoring test. It's a standard procedure where a cuff automatically inflates on the arm every 30 minutes to measure blood pressure while you sleep. The goal is to detect blood pressure spikes that might occur at night, which we now know can increase stroke risk. Ironically, that very test, designed to detect danger, may have caused the very stroke we were trying to prevent. The patient came to me 2 days after the test, complaining of unusual fatigue, mild dizziness, and slurred speech. Imaging revealed a small ischemic stroke, likely triggered by a combination of factors that the test introduced. She didn't sleep well that night, kept waking up from the cuff inflations, and didn't drink much water before bed because she didn't want to be running to the bathroom. In short, she was dehydrated, sleep-deprived, and anxious. That combination is dangerous, especially for an aging brain. And yet, this scenario is more common than you think. These aren't dramatic Hollywood-style strokes. These are often what we call silent strokes. Small disruptions in blood flow that don't immediately cause obvious symptoms, but gradually erode brain function over time. They may affect balance, memory, or mood. A person might just feel off and not realize their brain has been injured. The issue isn't the test itself. Technology is a vital part of diagnosis and treatment. The problem is how the test is administered, who it's administered to, and whether it's truly necessary. We often forget that the aging brain is far less tolerant of stress than a younger one. Even something as simple as going without food or water for several hours, something many tests require, can tip the balance in someone who already has fragile blood vessels, mild cognitive decline, or borderline high blood pressure. And it's not just blood pressure tests. I've seen complications arise after contrast dyes used in CT scans or MRIs. These dyes can affect kidney function, disrupt electrolyte balance, and cause temporary drops in blood pressure, all of which can increase stroke risk if not properly managed, especially in seniors who are already on multiple medications. And let's not forget stress tests either. These are designed to push the cardiovascular system to its limits to detect blockages or arrhythmias. But for some older adults, especially those with undiagnosed vascular issues, the combination of physical strain, fasting beforehand, and medication adjustments can be a recipe for disaster. We often label these procedures as routine because they are commonly performed, but common does not mean safe for everyone. What I've learned both through research and clinical experience is that seniors need a different standard of care, one that questions automatic assumptions and tailors testing to the individual's unique medical profile. It's shocking how often patients are told to simply follow instructions without being given the full picture. Rarely are they told to hydrate before a test, or to bring someone with them to monitor for confusion or fatigue afterward. Rarely are they warned about the interaction between their medications and the tests being performed, and almost never are they empowered to ask, is this truly necessary? Could we do something less invasive? The reality is that while these tests serve an important purpose, they are not risk-free. And for seniors, the margin for error is much, much smaller. As a brain doctor, I believe we have a responsibility to stop calling these procedures routine unless we've accounted for every possible variable, especially the age and vulnerability of the patient. So yes, I'm shocked, not because the science is wrong, but because the system so often overlooks what should be obvious. The aging brain deserves more careful, individualized care. One of the most important things I wish every senior and caregiver understood is just how delicate the aging brain becomes over time. When we think about getting older, we often focus on the joints, the muscles, or maybe the heart, but the brain, arguably our most vital organ, undergoes changes that make it far more vulnerable than most people realize. And in my years as a neurologist, I've come to see just how often these vulnerabilities are overlooked, especially in everyday medical decisions. You see, as we age, the blood vessels in our brains lose their elasticity, they become narrower, stiffer, and more fragile. The protective lining inside those vessels, called the endothelium, can weaken. That makes it easier for plaques to build up and harder for the vessels to adjust quickly to changes in blood pressure. So if someone has a sudden spike, a surge that might not faze a younger person, it can be enough to rupture a tiny vessel or dislodge a clot. That's how a stroke begins, and in older adults, it doesn't take much. The brain also shrinks slightly as we age. That's normal, but this shrinkage creates more room inside the skull, which can lead to tiny movements of the brain with every fall or bump, something that wouldn't matter in a younger person, but could lead to microbleeds or swelling in a senior. That's why falls become so dangerous later in life, not just because of broken bones, but because the brain doesn't have the same natural protection it once did. And then there's the cumulative effect of years of small, often unnoticed vascular changes. Many older adults have what we call silent strokes, tiny interruptions in blood flow that don't cause dramatic symptoms at first, but over time they accumulate. Memory slips, slower thinking, a change in gait or mood. These signs are often written off as just normal aging, but in many cases, they're evidence of actual physical damage in the brain. This fragility means we must be especially careful with anything that could put added pressure on the brain or its blood supply, especially sudden shifts in blood pressure, changes in hydration, or physical stress from certain medical tests or treatments. A person might go into a hospital or clinic feeling fine and come out confused, disoriented, or even neurologically impaired, not because of some major event, but because their brain simply couldn't handle the stress it was exposed to. One example I see often is when a senior is taking off certain medications before a test, or fasted too long, or doesn't sleep well the night before. These small factors on their own may seem harmless, but in an aging brain, they can cause enough instability to trigger a transient ischemic attack or even a full-blown stroke. And because these symptoms may not appear immediately, they're sometimes missed entirely until damage has already occurred. What's most concerning is how little this fragility is factored into everyday care. Many standard medical protocols are still built around what's safe or effective for a middle-aged adult, not someone in their 70s or 80s. That's a dangerous oversight. Older adults deserve assessments and treatments that respect the condition of their brain, not ignore it. As a brain doctor, I can't emphasize this enough. The older brain is not just a slower version of a younger one. It's a different landscape altogether. It needs to be protected, respected, and monitored carefully especially when we're making decisions about medical tests, medications, or procedures that could impact neurological health. I've seen too many patients suffer needlessly because that basic truth was forgotten in a moment of routine care. And that's something we can and must change. When we talk about stroke prevention in seniors, most people think of the big things: major surgeries, medications, maybe blood thinners or cholesterol drugs. But the truth is, it's often the small, day-to-day habits that make the biggest difference. These are the choices that, over time, either strengthen the brain's resilience or quietly wear it down. As a brain doctor, I've learned that prevention doesn't always start in the operating room. It starts at home, at the dinner table, at bedtime, and even in the conversations we have with our doctors. Let me give you a few simple but powerful tips that could significantly lower the risk of stroke and protect brain health, especially for seniors. First, stay hydrated. It sounds basic, but many seniors walk around slightly dehydrated all the time and they don't even realize it. Maybe they don't feel as thirsty. Maybe they're trying to avoid too many trips to the bathroom, or maybe they just forget. But dehydration thickens the blood, increases the risk of clotting, and puts unnecessary stress on the heart and brain. I've seen cases where something as minor as a hot day combined with a skipped glass of water was enough to tip the balance and cause a stroke. So make it a rule: water before coffee, water with meals, and water before bed, but not too much to disturb your sleep. Speaking of sleep, protect it fiercely. Poor sleep increases inflammation in the body, raises blood pressure, and interferes with the brain's ability to flush out toxins. Seniors are especially vulnerable to these effects, yet so many suffer in silence, thinking it's normal to wake up every hour or to feel foggy all day. It's not. If you're snoring heavily, waking up gasping, or feeling exhausted despite a full night in bed, that's a red flag. Talk to your doctor about sleep apnea testing or strategies to improve sleep hygiene. A rested brain is a stronger brain. Next, review your medications regularly, ideally every 6 months. Many seniors are on 5, 10, sometimes even more prescriptions. Some of these drugs interact with each other in subtle ways that can affect blood pressure, heart rhythm, hydration, or even brain function. I've seen patients come in confused or weak because their medications were clashing and no one caught it. So sit down with your doctor or pharmacist and ask them to explain every drug you're on. Ask, do I still need this? Is there a safer alternative? Could this be affecting my brain or increasing stroke risk? Now let's talk about movement. No, I'm not saying everyone needs to run marathons, but the brain thrives on blood flow, and that comes from gentle, consistent movement. A short daily walk, chair yoga, even light gardening. These aren't just good for the body, they literally help the brain stay nourished and oxygenated. Studies show that regular movement reduces the risk of stroke and dementia dramatically. It also boosts mood, balance, and sleep. Even if mobility is limited, simple leg or arm exercises can make a difference. Finally, one of the most underused tools for brain health is stress management. Chronic stress raises cortisol levels, which inflames the body and tightens blood vessels. That means more pressure on the brain and heart. Whether it's breathing exercises, prayer, journaling, listening to calming music, or spending time in nature, find something that gives your nervous system a chance to reset. I tell my patients, 10 minutes of quiet can be more powerful than a pill. These tips may seem small on their own, but together they form a protective shield around the brain. They help regulate blood pressure, reduce clot risk, improve sleep, and keep the brain alert and balanced. You don't need to overhaul your life overnight. Just start with one habit, then build another. Stroke prevention isn't about fear. It's about giving your brain the environment it needs to thrive. One of the most important messages I can share today, perhaps even more important than any medical fact, is this: you are allowed to ask questions. You are allowed to push back. You are allowed to say no. And if you're a senior or caregiver, I want you to remember this every single time you step into a medical office or hospital. Because for too long, we've treated seniors as passive recipients of care instead of active participants, and that mindset is putting people at risk. In medicine, the word routine gets used far too often. A routine scan, a routine blood test, a routine medication change. But what's routine for a healthy 40-year-old may not be safe or even necessary for someone in their 70 or 80s. The reality is, medical systems are often designed for efficiency, not personalization. But the aging body and brain demand a different level of attention, and that's where your voice becomes the most powerful tool you have. Let me be very clear. Asking questions is not being difficult. It's not being disrespectful. It's not being paranoid. It's being wise. It's being proactive. It's being safe. I've had patients who felt guilty about questioning their doctor, as if they were somehow betraying trust. But trust doesn't mean silence. True trust is built on open dialogue, on mutual understanding, and on shared decision-making. When a doctor recommends a test or procedure, ask, what is this for? What are we trying to find out? What happens if we don't do it right now? Ask about risks, especially how those risks might affect an older brain or body. Ask if there's a less invasive alternative. Ask if your current medications could make the procedure riskier. You're not challenging authority. You're gathering information to make the best choice for your health. Sometimes the medical system moves too fast. Tests are ordered reflexively. Medications are added automatically. Referrals are made without explanation. But you have the right to slow things down. I once had a patient scheduled for an advanced imaging scan that would have required contrast dye and fasting for 12 hours. She had mild kidney disease and low blood pressure, and the test could have harmed her, but no one noticed because the referral was processed without her doctor even reviewing her history. Thankfully, she asked the right questions and avoided what could have been a dangerous situation. I tell every senior patient I meet, bring someone with you to appointments, a spouse, a child, a friend, someone who can take notes, speak up, and help you process what's being said. Medical conversations can be rushed and filled with jargon. Having a second set of ears can be life-changing. And if something doesn't feel right, if a test, a medication, or a diagnosis leaves you uneasy, don't be afraid to seek a second opinion. Good doctors welcome that. They want their patients to feel confident in the care they're receiving. In fact, I believe one of the marks of a truly good doctor is their willingness to have their decisions questioned and discussed. This isn't just about preventing one bad test or avoiding one unnecessary procedure. It's about shifting the mindset around aging in healthcare. Seniors are not fragile burdens. You are wise, experienced, and often more in tune with your body than you're given credit for. Your insights matter, your comfort matters, and your intuition matters. Medical care should never be one size fits all. It should be built around you, your values, your goals, your life story. But that only happens when you speak up, ask questions, and insist on being seen as a full partner in your care. You are not a checklist. You are not just a patient. You are a person with a brain and a voice, and both deserve to be heard. It means that stroke prevention isn't just about reacting to emergencies. It's about proactive, thoughtful care that respects the unique needs of the aging brain. It means recognizing that even something as routine as a common test can carry serious risks if not handled carefully. It means understanding that the older brain is more fragile, more vulnerable, and yet incredibly worth protecting. But most importantly, it means you have a role to play. Whether you are a senior, a caregiver, or someone who loves an aging parent, your voice matters. Ask the hard questions, slow things down. Don't accept routine as an excuse for rushed or impersonal care. The truth is, so much of what we call aging doesn't have to be inevitable. With the right choices, hydration, sleep, gentle movement, stress reduction, and informed decision-making, we can preserve brain health far longer than many people think possible. I became a brain doctor to save lives, but over time, I realized one of the most powerful ways to do that isn't just through surgery or scans. It's by educating people, by helping them become advocates for their own brains. Because when you protect the brain, you protect everything. Your memories, your independence, your personality, your life. So don't wait until there's a crisis. Start today, be curious, be cautious, be bold. Your brain is worth it. So are you.